Hello, everybody. Thank you for joining. We will get started in just a few minutes.
Good afternoon, everyone. Thank you for being here. My name is Dr. Michelle Morse. I'm the Acting Health Commissioner and Chief Medical Officer of the New York City Health Department. I'm joined by New York State Health Commissioner, Dr. James McDonald, and Director of Respiratory Viral Pathogens at the City Health Department, Dr. Ellen Lee. I'm grateful to Dr. McDonald for joining us today. He has been a steadfast partner, and collaboration in these times that are so challenging in public health has been more important than ever. As we've been saying for several weeks, flu cases have been unusually high across the United States, in New York State, and in New York City this year. I'm holding today's briefing to provide updates on the current respiratory virus season, and most importantly, to reaffirm New York City and New York State's vaccine recommendations. As of the week ending January the 10th, more than 136,000 New Yorkers have tested positive for the flu so far this season, including more than 8,000 New Yorkers who tested positive just last week. One of our goals is to look at how COVID-19, flu, and RSV impact New Yorkers differently by race and ethnicity, so that we're better equipped to respond to respiratory viral season as equitably as possible. Today's numbers, however, are our citywide totals. And as we shared last week, while cases have been very high in the early months of this flu season, there is some good news. Over the last 3 weeks, lab reported cases have declined, but flu season is still far from over, and 3 weeks of decline is not enough to say if we've passed this season's peak. That is because flu is unpredictable and the virus continues to circulate at very high levels across New York City. COVID-19 cases remain low, but did increase by 13% last week compared to the week prior. We're also starting to see increases in emergency department visits and admissions for COVID-19 patients. This is not the time for New Yorkers to relax their efforts to protect themselves and their families and communities from these deadly viruses. The best tool that we have to protect ourselves, our family, and our communities is vaccination. Yet the federal government is undermining this life-saving tool. Robert F. Kennedy led the ungrounded overhaul of the federal childhood vaccination schedule and recently stated that it might be a better thing for fewer children to receive the flu vaccine. That is false, and it's also dangerous. In New York City, 52% of the lab-reported flu cases were among children under the age of 18. And last respiratory viral season set a new record for pediatric flu deaths. The vast majority were preventable. Nationwide, 89% of kids who passed away from the flu were eligible for the vaccine but had not received it. Federal leaders are spreading inaccurate information and are undermining public health. State and local governments are stepping in to fill the void. And as the oldest and largest local health department in the country, we're leading that change. This respiratory viral season, we're getting information to New Yorkers in many creative ways. Our strategies to reach the public must be as diverse as the populations we serve. This fall, we partnered with the WNBA champions, the New York Liberty, to promote flu vaccination. That included videos with star point guard Tasha Cloud and another New York City icon, Ellie the Elephant. We launched a campaign encouraging New Yorkers to stay safe and healthy this respiratory viral season so they don't miss out on the holidays with friends and family. And Commissioner McDonald and I had a really great time teaming up to launch an Ask the Experts video series to educate and inform New Yorkers this respiratory viral season. We're also in close communications with our colleagues across city agencies. We're collaborating with New York City public schools to get updated vaccination information to parents. And we're working with New York City Emergency Management to blast out flu messaging through Notify NYC. For those who subscribe, you should have received the alert moments ago. I'm grateful for our partnership with members of the press as well. Each of you, by joining us and including us in your coverage, supports our delivery of clear, accurate information to New Yorkers. Over the past few months, I've spoken about respiratory virus season on local, national, and international news networks, and Dr. McDonald has as well. Our press team has been fielding your many requests on this topic, and we launched these press briefings specifically to keep you all up to date on the latest information in a fast-moving and unprecedented flu season. You all in the press play a really instrumental role in helping us get clear and accurate information out to New Yorkers. And when it comes to public health, this information is literally life-saving. This respiratory viral season, our message is clear. If you've not yet received your updated flu and COVID vaccines or your RSV vaccine if you're eligible, it is not too late. You can find a vaccination site here in New York City by going to nyc.gov/healthmap or by calling 311 for assistance. Our online tool allows users to search by vaccine type and payment options, including sites that offer no-cost vaccination for people who are uninsured. We're working very hard to ensure that New Yorkers know that the flu, COVID, and RSV vaccines are available and that cost shouldn't be a barrier to accessing any of them. The RSV vaccine is a one-time immunization recommended to older adults and pregnant people, and flu and COVID-19 vaccines are recommended annually for everyone 6 months and older. While federal guidance may have changed, the science has not. And in New York, we follow the science. Earlier this week, Governor Hochul made clear that at her State of the State address that New York's immunization standards are set by trusted medical experts, not conspiracy theorists. As New York City's doctor, I echo the governor's sentiment. She has the power to ensure that happens in partnership with Dr. McDonald. Vaccine requirements for enrollment in schools are set at the state level, and for daycares, they're set at the city level. In New York, our recommendations haven't changed. I'm very grateful, again, for such great partners like Dr. McDonald at the state level, and I'm grateful also to the media who are here with us today who are really helping us get accurate information to the public, especially right now. I'll turn it over to my colleague, State Health Commissioner, Dr. Jim McDonald.
Yeah, thank you, Dr. Morse. I really value your partnership, and I do enjoy working with you. And New York City is very fortunate to have you, leading during this very challenging time. I just want to spend a moment thanking Governor Hochul, too. I think when you look at the national public health conversation, it's really important as a state health commissioner have a governor who's a champion of science and public health. I don't think people appreciate how significant that is. It really makes my job one that I can do authentically, and I think that's really important to everybody. And I want to start with there's really three reasons why this flu season has been so severe. One, flu came early this year. Two, we then all gathered for the holidays. And three, the dominant strain right now, H3N2, just very contagious and causes more severe disease. When I look at the hospitalization numbers for flu, when you look at January 3rd, we had 4,224 people admitted to the hospital for flu. The week ending January 10th, we reported 2,637. So that was a decrease of almost 40%. And cases went statewide from 35,000 to 21,000, so heading down as well. I've been in public health a long time, and there's an old saying in public health, if you've seen one flu season, you've seen one flu season. So although we're reporting 3 weeks of declining numbers, it's important to know that I've seen this happen before, where then all of a sudden it escalates again. I think one of the most important things to remember about influenza is you can get influenza more than once during the same season because the dominant strains change. Right now, we're dealing with influenza A virus, H3N2. We're starting to see some increase in another influenza A virus, H1N1. Keep in mind, influenza B tends to rise in New York later on in the season. And keep in mind, in New York State, flu tends to last through the end of April. So I feel like we still have an awful lot of flu in front of us. I think it's important to remember that, as Dr. Moore said, it's not too late to get a flu vaccine. It does take about 2 weeks for that vaccine to work, so I encourage you to avail yourself to that. Keep in mind, although we see the highest hospitalization rates in people older than 65, what might surprise you, the second highest group is people under 4, our little babies. So very important to remember that as well. Also important to remember, antiviral medications like Tamiflu work, but you have to take them within the first 48 hours for them to be the most effective. I did want to chat a little bit about COVID. Our hospitalizations with COVID remained about the same beginning January 10th as January 3rd, a little over 600. Important to remember, COVID vaccines available to you. You can get COVID and flu vaccine at the same time. That's how I did it. When I look at the RSV hospitalizations statewide, we saw a bit of a decline there. So the week ending January 10th, we were at 657 people, down from 852 on January 3rd. So we're seeing some progress in that space as well. But I think it's important to remember that we're dealing with these three infectious entities at the same time. We monitor at the State Health Department the hospital system. Earlier this year, we released the Hospital Capacity Direct Access System. It's a data modernization system we did under Governor Hochul. So we were able to monitor the capacity of hospitals much more closely than we have. And right now, although hospitals are feeling some strain, the area in the state that's got the biggest strain is the Finger Lakes region, but they're managing as well. And what we're also monitoring is emergency department offload times, which haven't changed throughout the state as well compared to this time last year as well. With that, let me stop my comments. Thank you all for attending, and I think we're just going to pause now for any questions that people might have. Thank you.
All right, thank you both for your remarks. So yeah, as mentioned, we will start questions now. If anyone has a question, you can write your name in the chat and your outlet. We also have, there is a hand raising function if you don't have access to the chat. So Mac Rosenberg from 1010 Wins, why don't you kick us off?
Hi, can you hear me?
Yes,
Hello, can you hear me?
we can hear you.
Oh, hi, sorry. Hi, Dr. Morse. Thanks for doing this. If you could just talk about a little bit more regarding the federal guidelines and possible mixed messaging when the federal government's saying one thing, but local governments and state governments are saying another. worry you as far as how people might respond?
Yeah, it's one of the biggest challenges we're facing right now, I will admit. And I will also say that we use a lot of different tools to try to really get a sense about what New Yorkers think, what questions they have, and what they know. And what we know is that there is quite a bit of trust actually in the New York City Health Department's guidance. And that we're trusted even more than the federal government guidance. So that's a little snapshot. When we use our survey tools, that's what we're seeing. At the same time, what we know is that this is an incredibly difficult message to get out and to make sure that as many people as possible are hearing our clear guidance about how to get vaccinated, why to get vaccinated, when again, the federal communications platform, really has its own following, its own, a scale and its own impact. So I do think this is a very confusing time. And at the same time, part of our goal today is really, again, to communicate directly to the public about the fact that the best protection and the best way to take care of your family, your community, is to get the updated vaccines. We can't control what the federal government is saying, but we do have relationships, partnerships, communication platforms, meetings, and many other methods that we use to both engage the public as well as all of our partner institutions across New York City to make sure that the message is clear and that our recommendations and Dr. McDonald's guidance from the state is what is still recommended here in New York City. Dr. McDonald, do you want to add to that?
There's no health benefit to chaos and confusion. Who decides who gets a vaccine in New York State is a state authority. So it's the states that decide who gets a vaccine and what the schedule is. So the states determine requirements and schedule. So thank you.
Thank you for that question. Reminder to the group, if you have a question, you can please use the hand raise function, or you can write your name and outlet in the chat. We do have a question in the chat from Lisa at Newsday. The question is, at what point would we know the season has peaked?
Can you hear me?
Yeah, I can hear you.
Oh, okay.
Can I take that question real quick?
Sure.
Yeah, so, when I said there's this old saying, when you've seen one flu season, you've seen one flu season, really just being honest with you, we won't know it's peaked until we really see much more time elapse here. One of the things I'm just concerned about is you've seen 3 weeks of declining numbers. What we don't know is what's going to happen. What we've seen in past seasons is it peaks, then it comes down, then it goes up again, almost creating like a big letter M. So we really won't know when it's going to peak until sometime. I think like Dr. Morse said so well, it's unpredictable. And the number of people we're still seeing in the hospitals is really quite substantial. I talked about over 2,600 people in the hospital. Keep in mind, last year our peak was 3,500. 2,600 plus, that's that week, so this is still a very significant flu season this year.
Just to follow up quickly, we did see that double peak. I think it was 2 years ago when the peak came like in the early spring. The one thing that has happened in the past that I haven't noticed this year is sometimes when you get into the thick of flu season, more people step up and get their vaccinations that maybe didn't in October and November. But I don't think you've seen much of an uptick in the last 2 months, despite how severe the season's turning out to be. Is there anything else that can be done to kind of convince people to get their shots? I know you've been doing a lot, but people don't seem to be doing, it seems to be even down more from previous years.
Yeah, when you look at the year-over-year numbers statewide, we see a 1% increase right now compared to this time last year. That concerns me because the strain of flu is more severe, so that's not going to get it done. So we need more people to get vaccines. As far as what more can be done, Dr. Morse and I have been everywhere and anywhere anyone's asked us to be. We've done a fair amount of outreach to healthcare providers. We've actually talked to the hospitals, the nursing homes. We're really doing everything we can. I think what's really important right now for the general public to kind of just ask themselves is I would just take a long, hard look in the mirror and ask yourself who you're listening to. Because if you're getting advice from someone who's not your doctor or your state or local health department, I'm just worried you're not getting it from an expert. I will just tell you, like, in 2025, people heard a lot of strange things. I think you're hearing strange things in 2026 as well. We're the ones who are very concerned about your health and well-being. We have no agenda with you. Our only mission is to protect your health and well-being. That's all we're trying to do here.
Thank you.
I'll just add two quick points to that. Agree with everything Dr. McDonald said. And I think, there is a bit of a data lag. So Lisa, I wouldn't say just yet that we're not going to see some uptick in the next few weeks in terms of the people who get flu shots. We're hoping that that's going to happen, and we're going to keep pushing for that to happen for sure. But as of at least last fall, we were down about 5% for pediatric flu vaccination rates, and that is concerning to us. And it's exactly what Dr. McDonald said. That's why we're out here using every platform we can. And I would love to ask Dr. Lee really quickly from our team to just share a little bit about that question, the technical side of that question, about how do we know whether or not we're past the peak.
Certainly. Thank you so much for that question. And as Dr. McDonald had mentioned, we do sometimes see another peak, so sort of what we might call bimodal, so more than one peak within the flu season, and that could very much represent a different strain that comes in of flu. So I think we're still in January, and though we've seen this encouraging decrease, we certainly know that the history with flu has shown that after January, we can still certainly see quite a bit of disease and a lot of virus transmission. And then if I may also add that, as Dr. Morse mentioned, we have seen a 5% decrease in the number of doses received by kids in terms of flu vaccine compared to last year. So this is concerning. And our overall vaccination coverage for flu in kids is just 32%. So these are all areas for which we would really like to focus some attention.
Thank you for that question. So we have one hand raised from Angie. Could you state your name and the news outlet that you're with? You're welcome to unmute yourself.
Hello, do you hear me?
Hi, yes, we can hear you.
Okay, I am Angie Damlaki from Al Liwa Al Arabi newspaper, and I have a questions about that many immigrants face language barriers and limited healthcare access. What specific measures is the department taking to ensure that they receive timely testing, treatment, and accurate information?
Yeah, thank you so much for that question, Angie. It's one of the most important questions for sure, is to make sure that every community across the incredible and beautiful diversity of New York City has access to this information. Some of the things that we do in that realm, we do make sure that all of our materials are translated into multiple languages, and in fact, often do briefings actually also for media that do their communications in languages other than English. We also do quite a bit of partnership with community-based organizations that serve particular communities that might speak languages other than English. Those common ones here across New York City, of course, that we focus tremendously on are Spanish, Mandarin, Russian, and a number of others. But I just want to be clear that that is a big priority for us. We learned a lot during the COVID pandemic about how to do that better. And I would say now, having been at the health department for 5 years and seeing that evolution, I'm really proud of how much we've been able to increase our engagement of both immigrant communities all across the city, as well as improving our language access. I don't know, Dr. McDonald, if you want to say anything else about the state side. Great.
I think you covered it well. We can go on to the next question.
Okay, great. We have time for one more question. We have a question in the chat from Trenton Daniel at HealthBeat. Trenton, do you want to come off mute and ask your question?
Hi, sure. Thanks for organizing this. Yeah, I put the question in the chat, but I mean, I was just wondering, of the people who've been hospitalized for flu, do you all have any way of knowing if they've been vaccinated, and if there might be any stats on that that might be available?
I was
So,
going to suggest Dr. Lee, if that's okay with you, Jim.
Sure.
go ahead.
Yeah.
Sure.
Oh, sure. Thanks so much. So unfortunately, we don't receive vaccination information along with any information about being admitted to a hospital. So we don't have we don't have a response to that question as you framed it. In addition, we don't receive vaccination information for adults. So so we don't we can't quite respond to that question. We do know that this current vaccine and this current seasonal vaccine in an early study in the UK had shown about 75% effectiveness at keeping children out of hospitals and about 35% effectiveness for keeping adults out of hospitals. But we don't have those type of data locally here in New York City.
I do want to just emphasize this statistic that Dr. Lee mentioned at the last briefing, however, which is that last pediatric flu season, the national data showed that about 90% of the children who passed away from flu were unvaccinated. So we know that there's definitely an important connection. I know you asked about hospitalization, but that number is really striking.
I would say that's both nationwide and also here in New York City, that among the kids who could have been vaccinated, only 90% of them were not vaccinated.
Okay, thank you so much for all of your questions. That now concludes this media briefing. Thank you again to our panelists and to the state, Dr. McDonald and to Dr. Michelle and Dr. Michelle Morse and Dr. Ellen Lee for joining.
Thanks, everybody. Stay well.